How does the liver's remarkable regenerative capacity contribute to the challenges and potential treatment strategies for liver cirrhosis? Liver cirrhosis is a progressive and irreversible condition characterized by scarring and damage to the liver tissue. It can be caused by various factors such as chronic alcohol abuse, viral hepatitis infections, and autoimmune liver diseases. As liver cirrhosis advances, it can lead to complications such as ascites, hepatic encephalopathy, variceal bleeding, liver cancer, and malnutrition. Early detection, proper management, and treatment of underlying causes are essential. Lifestyle modifications and medical interventions can help slow down the progression of the disease and improve overall prognosis. 1. Fatigue and weakness. Feeling constantly tired, weak, or lacking energy is a common symptom of liver cirrhosis. 2. Jaundice. Yellowing of the skin and eyes due to the buildup of bilirubin, a yellow pigment in the body. It occurs when the liver is unable to process bilirubin properly. 3. Ascites. The accumulation of fluid in the abdominal cavity causing abdominal swelling and discomfort. 4. Edema. Swelling in the legs, ankles, and feet due to the fluid retention. 5. Easy bruising and bleeding. Liver cirrhosis can cause a decrease in blood clotting factors, leading to easy bruising and prolonged bleeding. 6. Itchy skin. The buildup of bile products in the bloodstream can cause itching. 7. Loss of appetite and weight loss. Cirrhosis can affect the body's ability to digest and absorb nutrients, leading to a decreased appetite and unintentional weight loss. 8. Nausea and vomiting. The liver's reduced ability to process toxins can result in nausea and vomiting. 9. Mental confusion or changes. As liver cirrhosis progresses, it can affect brain function, leading to confusion, memory problems, personality changes, and even coma. 10. Spider angiomas. These are small, spider-like blood vessels that appear on the skin, particularly on the face, neck, and upper body. It's important to note that these symptoms can vary in severity and may not always be present. If you experience any of these symptoms or have concerns about your liver health, it is recommended to seek medical attention for a proper diagnosis and appropriate treatment. So how's the video so far? If you liked the video, be sure to like it. Also, if you like this type of videos, subscribe to our channel. Thanks a lot. What are the treatment options for liver cirrhosis? The treatment options for liver cirrhosis depend on the underlying cause and the stage of the disease. While liver cirrhosis is irreversible, the goals of treatment are to manage complications, slow down the progression of the disease, and improve the quality of life. Here are some common treatment approaches. 1. Lifestyle changes. If alcohol abuse is the cause of cirrhosis, eliminating alcohol consumption is crucial to prevent further liver damage. In cases of non-alcoholic fatty liver disease, adopting a healthy lifestyle with regular exercise and a balanced diet can be beneficial. 2. Medications. Medications may be prescribed to manage specific symptoms and complications associated with cirrhosis. For example, diuretics may be used to reduce fluid buildup and swelling. Other medications may be prescribed to manage complications such as portal hypertension, example beta blockers, or hepatic encephalopathy, example lactulose. 3. Treatment of underlying causes. If cirrhosis is caused by viral hepatitis, antiviral medications may be prescribed to control the viral infection and prevent further liver damage. In the case of autoimmune liver diseases, immunosuppressant drugs may be used to reduce inflammation and slow down the progression of the disease. 4. Transplantation. In advanced stages of liver cirrhosis, when liver function becomes severely compromised, liver transplantation may be considered. During a liver transplant, a diseased liver is replaced with a healthy liver from a deceased or living donor. 5. Management of complications. Cirrhosis can lead to various complications such as ascites, hepatic encephalopathy, variceal bleeding, and liver cancer. Treatment options for these complications may include procedures like paracentesis, fluid drainage, banding, or sclerotherapy to treat varices, or liver cancer treatments such as surgery, ablation, or transarterial chemoemmobilization (TACE). It's important to remember that treatment plans for liver cirrhosis are highly individualized and should be developed in consultation with a healthcare professional who specializes in liver diseases, such as a hepatologist or gastroenterologist. They will consider the specific circumstances and needs of each patient to determine the most appropriate treatment approach. What are the common complications associated with liver cirrhosis? Liver cirrhosis can lead to several complications as the disease progresses. These complications can vary in severity and may require specific management. Here are some common complications associated with liver cirrhosis. 1. Ascites. It refers to the accumulation of fluid in the abdominal cavity. Ascites occurs due to the increased pressure in the liver's blood vessels, portal hypertension, and decreased production of a protein called albumin. Ascites can cause abdominal swelling, discomfort, and increased risk of infection. 2. Hepatic encephalopathy. As the liver fails to remove toxins from the blood, it can lead to a buildup of toxic substances, particularly ammonia, affecting brain function. Hepatic encephalopathy can cause confusion, personality changes, forgetfulness, sleep disturbances, and in severe cases, coma. 3. Variceal bleeding. Portal hypertension can cause the development of enlarged blood vessels called varices in the esophagus and stomach. These varices are prone to rupture and can result in severe bleeding, which can be life-threatening. Symptoms include vomiting blood, black tarry stools, and signs of shock. 4. Spontaneous bacterial peritonitis (SBP). Ascites can increase the risk of bacterial infection in the abdominal cavity, leading to SBP. It can cause abdominal pain, fever, altered mental status, and worsening ascites. Prompt medical attention is required to treat the infection with antibiotics. 5. Hepatorenal syndrome (HRS). It is a severe complication characterized by kidney dysfunction in individuals with advanced liver disease. HRS occurs due to the changes in the circulation and blood flow within the liver. It leads to reduced kidney function and can cause fluid retention, electrolyte imbalances, and kidney failure. 6. Liver cancer (hepatocellular carcinoma). Liver cirrhosis increases the risk of developing liver cancer. Regular surveillance and monitoring for the development of liver tumors are essential in individuals with cirrhosis. 7. malnutrition, and weight loss. Liver cirrhosis can interfere with the body's ability to process and absorb nutrients, leading to malnutrition and unintentional weight loss. It's important to note that the presence of these complications requires close medical management and treatment. If you have liver cirrhosis or suspect you may have it, it's crucial to seek medical attention for appropriate evaluation, monitoring, and management of any complications that may arise. Before finishing this video, I invite you to watch our video about foods that we eat every day for prostate health. Like always, if you have any questions or suggestions, we're here to answer them in the comments section. Thank you for watching, and be sure to like, subscribe, and share this video with anyone you think it could be helpful to them. I'll see you soon.